Thank you. Good morning, good afternoon, good evening, no matter where you are. I appreciate you for coming out to this webinar. Laboratory developed tests are a very interesting field. It's a field that I have some degree of experience in. As my introduction said, I do have a good deal of experience in clinical diagnostics, particularly in this realm. The thing is that this field had a number of unique challenges, especially with the change in the regulatory regime, which I'm going to get into in further detail. However, these changes aren't going to have that much of an impact if you understand what's going on and if you have developed the right procedures in order for your test to work. I have to do a lot with the history of laboratory developed tests and what have you, and I'll get into that as we get into this webinar. So, moving along. Laboratory developed tests, very popular for clinical diagnostics. They have their roots in just simple lab work. Just ever since there were clinical labs, there were laboratory developed tests. This clinical labs started around the 1890s, which is when the field first developed. Commonly used particularly for unusual, specialized, complex, or rare tests. For example of unusual, there are certain tests that look for particular markers that are prognostic for a certain disease that are used as tiebreakers, so to speak, where if someone isn't sure whether a person has X condition or Y, they'll go to those particular markers. Specialized, that they're used in particularly narrow circumstances, with particular disease states, particular diseases, conditions like pregnancy. Complex, where there's a lot of interpretation. That complex is the key thing as we move forward in terms of regulation. And rare diseases. Say you have some disease that's very uncommon, they ran through the standard set of tests. Usually the last line tests are these lab-developed tests that are used to make important decisions. Now, historically there have been questions about regulation. Since the Food, Drug, and Cosmetic